Thanks for taking the time, Christian. If you just want to give us a little bit of your story, your background, where you're currently working, and what kind of work are you doing?
Yeah, so I graduated in 2022, then did my first 12 months up at the sunny coast of private practice Forbes Care. So community NDIS provider primarily. I was sort of a bit of jack of all trades, master of none, doing a lot of NDIS reporting, bit of AT here and there. Also had sort of probably a 30% caseload of DVA as well. And then as of April last year, I moved back down to Brisbane and I'm now working for Lifetec Australia. We're based over at Milton. So there I'm primarily have been primarily in STRC and a little bit of CHSP and NDIS as well. But at Lifetec we are AT and home mods specialized services. So pretty much all I've been doing is AT and home mods there. And that's probably has been my clinical area of interest for a number of years, even while I was still at uni. So it's been a really good fit for me since I've been there.
Right. And so, why did you choose community and specifically Home Mods AT?
Well, to be honest, the reason I became an OT in the first place and even studied it at uni was back when I was at high school, my grandparents had a very good community OT, got them some high-low beds and a couple of grab rails put in that I actually got to see from the other side of the fence and how much of an improvement it made for their just safety and quality of life as well. And then I was always keen to do placement in that area, which I did do while I was at uni in my final year. And then, yeah, I just really enjoyed that placement. Was never really one for sort of the hospital lifestyle, or pediatrics was never my thing either, as you know, Mel. So, yeah, I just sort of naturally fell into it and have been really enjoying it ever since.
Right. And so, you just identified you prefer to work with adults, and I know that you're working quite a lot with older adults.
Mm.
What does your work look like with older adults?
So in the STRC program, we actually contract our OT services to another company who sort of oversee the STRC program. So typically through that, a lot of what I do is just sort of minor home mods, grab rails, ramps, half steps, those sorts of things. And at the same time, I usually be looking at a little bit of AT, whether it's sort of basic kitchen aids like your tip kettles or your adapted cutlery, some shower chairs, over toilet frames, those sorts of things. And then in the CHSP space, we actually have received a government grant for the home modification service. So we primarily just do home mods through that. If a client has a geek to go referral code, we might assist them with some sort of very cost effective AT, but that's usually the extent we do through that space. NDIS is obviously a bit more complex, but that's sort of primarily my role in the aged care sector.
Okay. And what do you like about that work in working in that aged care sector?
Um, Probably the thing I'd go to first is just how particularly appreciative the oldies generally tend to be. Um, like I've obviously worked a fair bit in NDIS and it's obviously quite complex work and you probably don't always, and like it's probably sounds a bit selfish, but you probably don't always get that sort of gratification or even just sort of the thanks from people at times. And like we don't do it for that. Right? Like we don't get into this industry for that, the praise and that sort of thing. But I think yeah, just this sort of how grateful that older demographic tend to be, just even with some quite basic equipment. Like you go and do your exit review and you teach them how to use the couple of things, and they're always just so appreciative and just grateful for your advice and expertise and that sort of thing.
And what would you say are your pet peeves in working in this area?
Um, Probably always a few, but probably one of the bigger ones is just probably the limitations with the aged care space. Like with NDIS, obviously there's a bit more grey area, so you can probably push a few more things through that In the aged care space is a bit more sort of clear cut, black and white. No, this will or won't be funded. Um, and obviously, there's always going to be some things that it makes complete sense for them to have a certain product or piece of AT. But just with the way that the guidelines work and the limitations that we work within in the aged care space, it's can be quite frustrating at times from that perspective.
And you've mentioned a couple of the funding schemes in there in terms of the STRC and CHISP. Are they the predominant ones you've worked under?
Yeah, so STRC is probably the one I've worked with the most over the last 12 months. But I have worked in home care package as well as CHSP. Home care package, I probably did a bit more of at my old job, as well as while I was up on placement as well back at uni. And yeah, I probably have the most experience with STRC, I'd say at this stage, but CHSP, I'm sort of quite familiar with as well, and that's probably where more of my caseload is heading, probably in the next couple of months, I'd say actually.
Mm. And in terms of those schemes, do you have any key points of difference or things that are really important to know in terms of working within those schemes?
Um, One thing I will say about the aged care space is it's very convoluted, particularly people who are deemed to be higher functioning or have lower care needs. So I find the CHSP program to be quite overwhelming for some people, and just sort of how the referral code system works and knowing where to look to find providers and that sort of thing, because they don't, unless they've got a really good support network, particularly I find it's often the kids, so the adult kids, the clients I'm working with that help them navigate the system. Um, but yeah, in terms of how to operate CHSP, it's very much a client contribution involved, whether it's to pay for the home modifications or any equipment beyond that sort of $1,000 that they can get through GEAT. Whereas with home care package, it's pretty much, and STRC to an extent, pretty much everything that's recommended or provided by the OT is generally covered by the funding that they're sort of accessing.
Mm. And have you experienced anybody running out of funding?
Yeah, very, very commonly, particularly in the STRC space. It's because it's such a sort of a time-intensive program, and often you're going in there and doing your comprehensive assessment. And you're identifying a whole heap of things that they would benefit from. So they sort of have to make a decision about how they want to spend their funds, whether it's to get one more, sort of one of the more higher bigger ticket items like a recliner chair or a high-low bed or something like that, then they might have to forgo some of the lower cost things like your shower chairs and your grab rails and those sorts of things. And similar in the home care package space, it's sort of like we've saved up enough money to get this bed, but we don't have the funds for your kitchen aids or something for the time being.
Yeah, okay. So there's a range of different kind of schemes that you're working within and across. Do you have a preference in terms of which ones you like to work in or which ones are more challenging?
Um, Probably personally, and this is probably more of an issue that I find internally at Lifetec is the freedom of builders that we've got in CHSP. Generally speaking, as long as your company that you're working for has got all the compliance documentation for the builders, you can sort of use pretty much whoever you want. You've got that sort of freedom. Whereas with the STRC program, because it's not like we're just contracting out the OT services, we're very limited in terms of the builders we can use. So I think the CHSP space is probably my sort of preference. And the other thing with CHSP is a lot of the clientele that we're working with, they do tend to be sort of higher functioning, for lack of a better term. And I just find that those clients, they tend to be a bit more receptive of the advice you're giving them. You're not really needing to step the whole process out to them as much as someone with sort of some higher care needs and support needs and that sort of thing.
Yep. And we're aware that there is lots of changes happening kind of currently or coming in the aged care system. How do you think you're feeling about that as a clinician on the ground?
It does leave, obviously, does give you a bit of uncertainty in terms of what it's all going to look like. And like we're constantly in communication with our CEO and aged care manager and compliance manager, all those sorts of guys who are sort of making sure that we're all doing what we need to be doing. But I guess as the clinician, it probably makes me think a bit more about sort of long term, the types of work that I want to be doing, who I want to be working with, whether I still want to work in aged care, whether I want to transition into something else, what other funding schemes there might be out there that I could work within. All those sorts of questions have come up every now and again, just in my own head more than anything.
Mm. And how do you think, like, as somebody who's connected with other clinicians in this space, how do you think everybody's feeling on the ground, just generally speaking?
Yeah, I think the key word's probably uncertainty. Yeah, a lot of us are sort of a bit unsure about what lies ahead. And I think people, like some people, are probably leaning into that a bit more than others, whereas some people are probably a bit more risk averse and sort of just want to find the jobs like the NDIS work that's probably, even though it's not as financially viable at the moment, with the lack of pricing increases. It's probably going to be a bit more of a longer term, more stable type of work, in the NGO space. So yeah, I think it's probably a bit person to person, but uncertain is definitely across the board.
Mm. And what supports do you have in place to help you manage the workload that you do within the aged care sector?
Well, we've got quite a really supportive, just OT team generally. I find that when I was interviewing for Lifetec, the KPIs expectations were quite low in comparison to some of the other organisations out there, particularly the for-profits, whereas at Lifetec we're a not-for-profit. So we've sort of got that flexibility to spend a bit more time liaising with the rest of our team, sort of brainstorming ideas, getting our work sort of peer reviewed or cross checked and that sort of thing. But supervision is obviously a big part of what we do, and talking to our clinic lead, or we've got clinical champions as well who sort of specialise in a particular area, I guess. So, for example, I'm the bidet clinical champion. So if people have questions about bidets, they'll usually come to me. So yeah, it's quite a collaborative sort of process internally at Lifetec we've got.
And so, did you do any additional training after you finished uni to support you in the kind of work you do in the age sector?
Yeah, so there's probably a couple. I obviously have done my complex home modifications training to now be a qualified home modifications assessor. So the NDOS can approve the complex applications that I submit. But I, like through Lifetech, I've been approved to do quite an extensive amount of work with Liz Ainsworth. So I've been to quite a few of her webinars and workshops and that sort of thing that she runs. I also have worked quite closely with some of the errata resources that are out there as well. So, and like obviously, I went to the errata conference in November. So, yeah, I've been really well supported by Lifetech as well, just from accessing different PD and stuff that's out there too.
Right. And if you were to give three top tips to, a future professionals who might be working towards um, being part of this area in their clinical practice, what would be your three top tips?
Um, Probably the first one that comes to mind would be um, just making sure you're asking for help when you need it. The thing I've learned, in particularly in the realm of home mods, is the more you learn, the more you realise you don't know. Um, so yeah, just making sure you are putting the ego aside and asking the questions, being like, "Hey, that doesn't actually make sense. Can you explain that a bit more to me?" Second tip would be making sure you're communicating with your clients too and setting expectations for them, whether it's aged care or NDIS. I just find that across the different schemes and sectors, there's quite a bit of uncertainty and sort of people just don't understand what is out there. Particularly in the aged care space, I find that I'm often doing AT trials with people in their homes, and they always say to me, "Oh, I didn't even know half of this existed." So, just having those open communication lines with people and just sort of helping them explore what's out there is really helpful. Um, Third tip, um, put me on the spot a bit there. I probably find um, making sure you're not sort of taking a cookie cutter approach to every client is probably the other suggestion I'd put out there is yeah, like every home environment you work with, every individual, every client is different. They all have their own individual needs. And like as a student, I was sort of crying out for a black and white set of guidelines and this is what you do with this situation for this type of grab rail. And it just like obviously we've got different Australian standards like AS 1428 and all that sort of thing that can sort of help guide what we do. But very rarely is it always the best approach to just work purely off some guidelines that are out there because at the end of the day they're just guidelines and they're for a specific set of people too. So yeah, taking sort of an open mind to every client that you work with is probably my third bit of advice.
Perfect. Now, I'd hoped to finish there, but because you opened the door on Australian standards, can I ask you, how do they impact or influence your practice?
Um, they're probably becoming increasingly apparent for me personally. Um, in the NDIS space, and particularly the complex home mod space, I'm finding that the NDIS are pushing back a fair bit, and they're making us try to comply to those standards a lot more than probably years gone by. The issue with that is that that Australian standard, I'm actually finding that I'm having to educate the NDIS planners that those standards are not necessarily applicable for either my client because they're only for people at the ages of 18 to 65. So if I'm working with a kid or a pediatric client, that standard is actually not applicable. The other aspect of it is that those standards are for public dwellings. So a lot of residential homes that are on their own block of land, they're also not applicable there. So as I say, they're more for us to be used as a guideline, which we help to guide us around shower sizes and toilet positioning and vanities and all that sort of thing. But yeah, it's one of those things where it's only useful to a certain point as opposed to being the sole thing that guides what we do. So yeah, it's a tough one.
And do you find that that happens in the aged care sector as well, knowing that the AS 28.1 was only developed for 18 to 64s? Do you get that similar push in the aged care sector, or is it a bit more flexible?
It's definitely at this point in time, it's definitely a bit more flexible. Obviously, with the changes that are happening in behind the scenes from a government perspective, I'm sort of keeping a close eye on it because I have a suspicion that it's probably going to be a bit more enforceable, like in the NDOS. There's sort of a bit more pushback on it. But at this point in time, I'm finding that it's not as big of a concern and it's sort of up to my clinical judgment a bit more. And that's probably goes back to your question earlier about what I find enjoyable about the aged care space is that it's sort of people take your clinical judgment on face value and there's sort of a bit less asking questions and getting you to justify things a bit more. It's sort of if you recommend something, you've recommended it for a reason. And yeah,
Great. All right. Well, that's great. Thank you so much for your time. Really appreciate you sharing your thoughts.
not a problem. Always a pleasure, Mel.